Good morning, Sangeeta. Thank you very much for joining us. I know it's only about, 12 hours since this announcement has come. We have not been able to touch base with Serum Institute, but what is your sense? You think this can start off pretty quickly? Are enough vaccines being manufactured for both private and government sector to keep the dissemination going?
So morning, Lata, and like you undoubtedly said, this is a fantastic step and a very positive step towards this overall vaccination of the country. I definitely believe that we have adequate vaccines, and that's exactly why the government has opened this up to accelerate the pace of delivery of vaccine. So as you know, we all know we should be extremely proud of the fact that we've been following a public health approach to the vaccination drive. So healthcare workers first, then you go to the frontline workers, and then the vulnerable, over 50, over 60, over 45. All these categorizations are towards doing a orchestrated approach. Now that this phase of opening up to private, it's purely to accelerate the delivery. And that is happening on the back of the fact that the vaccine manufacturers are very clear that they have adequate supply. So I think, this is just a matter of moving to the next phase of getting the country safe, of driving towards herd immunity. So we have enough people who are doing this. And I think from your perspective, it's getting one step closer to a completely revived economy.
Oh,
yes,
absolutely.
of course.
Yes, in fact, we're looking forward, right? It's such a big relief for us, for our parents, our grandparents, the fact that the drive will be accelerated. But
Absolutely.
What about the pricing, Sangeeta? The price is estimated at around 400 rupees per shot. That's what I understand private hospitals will be charging. In your assessment, is that a sufficient price?
So, of course, clearly it depends on the price of procurement of the vaccine. If we get the vaccine at the same price as the government, this 200, 250 that we have heard about, then this should be an adequate price to move forward. The government is supplying the vaccine. This is completely fine. If we have to procure, I think you look at the cost of procurement with an additional price of about 200, 250 should be more than adequate for everything, including cold chain, administration, and very significantly, we must remember pre-vaccination monitoring of the individual. Because everyone does need to, we have to keep a track, make sure they come back again. And of course, coordination with the COVID app. So ensuring that we upload the data or we link our systems with that data. So all these steps, but it's something we've been clearly planning. We are ready to do. And March 1st, I'm sure all 20,000 private facilities who are getting designated right now will be ready. So you will have 30,000 centers approximately doing 100 to 200 vaccinations per day. This is from 30 to 60 lakhs per day is now the capacity of India. Most likely this could go up even further because, some of our centers can do upwards of 500 to 1,000. So considering that, you're going to see a huge ramp up, which is a step in the right direction for us.
Sangeeta, you've taken away a lot of the questions that I was going to ask
sorry,
you. No, perfectly.
We've all been waiting.
I was going to ask you how many centers, how many per day, and, therefore, what can we estimate in terms of the pace of vaccination? Most of those you've answered. So what do you expect? Azim Premji was talking about 500 million in 60 days. That is the doable number?
Definitely.
Oh,
Definitely. And I think that is something we should ramp up, aspire to, and the sector is capable of doing this.
So before the rains, half the country should be vaccinated.
That's a wonderful step.
Okay. Well, I wanted to ask you about this 400 rupees itself. Is 400 rupees the right price? Because the government will always try to make it a little lower. So if it is below 400, do you think that will be a bit of a negative?
See, right now, Lata, I don't think anything will be a negative because looking at the overall picture and the fact that the pressure has been so much, we want our patients to, be safe. You look at elderly, you see the tension that everybody is having. You and me about, parents, aunties, everybody. So anything that just covers costs is adequate to move ahead. Now, the aggressiveness with which you go about it, etc., is something that a little bit of a margin will help do that, but it really doesn't matter. In this case, it's a public health initiative, all of us together, and we all know that this will help the entire economy, every hospital come back to normal. So it's a move we've just been waiting for.